Gage Primar here, crushbackpain.com. This is the third video in the piriformis syndrome series. The first video started with the exercises that you want to begin with if you have sciatica pain due to piriformis syndrome, and the second video progressed those exercises. Today in the third video, we're going to further progress those two exercises. We're going to continue to work on the gluteus medius and the gluteus maximus to minimize stress and strain on the piriformis muscle, thus minimizing excessive compression and tension on the sciatic nerve. So today we're going to start with an open chain exercise, meaning your leg is going to be moving through space instead of planted on the ground. And I call this the glute med sequence. This is a really good sequence of exercises. It's 4 different movements that you do in a row, back to back to back to back without any rest. And it really improves the strength, the control, and the endurance of the glute complex. And then we're going to follow that up with some more single leg work, higher rep work, to really just continue to work the glute med, take compression, tension off that sciatic nerve. So the first exercise, you're going to be on the ground. We started out in this series with saying we had sciatica symptoms, piriformis syndrome on the right, so we're going to stick with that. So for this first exercise, your right side is going to be up. So you're going to be lying on your left side, right side is going to be up. And you're going to start with simple hip abduction, but you want to do it in a really specific way. So your femur is going to stay in line with your trunk. You're going to have a tendency when you raise your leg, this is hip abduction here, this is what we start with, you're going to have a tendency to use your TFL muscle, your tensor fasciae lata. So your leg's going to want to come forward. That's what you don't want. That's not going to help you any. So your toe's going to be pointed slightly down. Femur is in line with the trunk, and it's a pretty minimal motion. So you're not coming all the way back down and all the way up here. It's probably about 30 degrees. You keep that femur in line with the trunk. 4 or 5 reps. I can already feel this working. If you feel this area back in your glute working, back behind your femur, right here, you're doing it right. If you feel this area in the front working, you're doing it wrong. So again, toes slightly down. You're not coming all the way back down, maybe coming up 30 degrees. You're going to start out with about 8 to 10 reps, just like that. Then, without resting, once you get 8 or 10, then you're going to go straight back. Again, 8 or 10 reps straight back. And then once you do 8 or 10, you're going to do 8 to 10 circles forward, and then 8 to 10 circles back. And that's the glute med sequence. Now, just showing you guys that, I was starting to burn right here. That's what you want. You want to feel it here, not here, okay? So you start out with 8 to 10 reps with each of those motions, and over the course of the next 2 weeks, you work up to where you're doing about 15, even 20 reps. To work up to 20 reps is probably going to take you about a month, maybe even 5 or 6 weeks. But once you get up where you're able to do 15, 20 reps with each movement, abduction, extension, and the hip circles, your glute complex is going to be pretty strong. Endurance is going to be good. Control is going to be solid. So you're going to do that first. After you do that, you're going to, and I have a bench here, so I'm going to use a bench. But you can use a chair, you can use a couch. It doesn't have to be the exact height of this bench, but we're going to go to a rear foot elevated split squat. So this is essentially a single leg squat movement, and our right leg, we're saying symptoms are on the right, whatever side your symptoms are on is the leg that we're working. So I have piriformis syndrome on my right side, so my right leg is going to be on the ground. The back leg, which in this case is my left leg, it's going to be back on the bench. Again, you can use a chair, you can use a couch, you just want that rear foot elevated. That forces all the work onto the front leg. So we're going to shoot for about 15 or 20 of these, and you're just going to go down and up. You might have to adjust a little bit. You don't want to let that femur slide in. Keep the knee over the second toe, and you're just down and up, down and up. And you're going to do about 15 or 20 of these, and it's going to work your quad, but it's going to start, you're going to start filling it out here as you get into those higher rep ranges. Again, really control the femur. You don't let it kick in or rotate in, it stays out, knees tracking over that second toe. I'm starting to fill that out here. So 15 or 20 reps, just like that. Those are the two exercises that you're going to really focus on in the 5th and the 6th week. Do those twice a day, just like the other drills, and this will just get you further along and help you to continue to heal, help continue to balance out whatever's causing that piriformis syndrome. If you like this video, leave me a thumbs up below, leave me a comment. Also, if you have any questions on piriformis syndrome, sciatica, lower back pain, ask, and I will do my best to cover those questions here on the Crush Back Pain YouTube channel.